What is uterine cancer? Symptoms, causes, and prevent. Be there. Welcome back to the channel. Today we're talking about a topic that could literally save lives: uterine cancer. Now, I get it, cancer is a scary word. But staying silent and unaware, that's even scarier. So whether you're here to learn for yourself, for a loved one, or just to stay informed, you're in exactly the right place. In the next 10 minutes, we're going to break down what uterine cancer really is, the most common symptoms you should never ignore, what causes it, and most importantly, how to reduce your risk. Let's get into it. Now I will discuss and explain to you. We need to understand what cervical cancer is. What is uterine cancer? Let's start simple. Uterine cancer is a type of cancer that starts in the uterus, the organ in a woman's pelvis where a baby grows during pregnancy. Now here's something important. There are two main types of uterine cancer. 1. Endometrial cancer. This is the most common. It starts in the endometrium, the inner lining of the uterus. Nearly 90% of all uterine cancer cases fall under this type. 2. Uterine sarcoma. This is much more rare and develops in the muscle or connective tissue of the uterus. It tends to be more aggressive and harder to treat. In most cases, when people talk about uterine cancer, they're referring to endometrial cancer. And here's a fact: uterine cancer is the fourth most common cancer among women in the United States after breast, lung, and colorectal cancer. Now let's discuss who among women is most at risk. Who is at risk? Now, who's most at risk? Uterine cancer typically affects women over age 50, but younger women can get it too. Here are the key risk groups: postmenopausal women, women with obesity, women with type 2 diabetes, women with polycystic ovary syndrome, PCOS, women with a family history of uterine, colon, or ovarian cancer, women who've never had children, women who took estrogen-only hormone therapy after menopause. On major genetic risk is something called Lynch syndrome, which increases your chances of developing uterine and colon cancers. Symptoms to watch for. Alright, this is super important. Here are the top warning signs of uterine cancer. 1. Abnormal vaginal bleeding after menopause. Major red flag. Bleeding between periods, also concerning. 2. Unusual vaginal discharge, especially if it's watery, pink, or blood-tinged. 3. Pelvic pain or pressure. 4. Pain during intercourse. 5. Unexplained weight loss or fatigue. Now, listen closely. If you're postmenopausal and experience any bleeding, don't wait. See a doctor. It may not be cancer, but it needs to be checked. Causes of uterine cancer. So, what causes it? In many cases, a hormonal imbalance is the trigger, especially too much estrogen without enough progesterone. This imbalance can cause the endometrial lining to thicken abnormally, which can lead to cancer. Other major causes and risk factors include obesity. Fat tissue produces extra estrogen. Diabetes. Higher blood sugar levels are linked to cancer risk. Never being pregnant. Pregnancy lowers lifetime estrogen exposure. Family history, especially if someone had uterine or colon cancer. Use of tamoxifen, a drug used for breast cancer, which can slightly increase uterine cancer risk. Radiation therapy to the pelvis. Past treatments can slightly raise risk. But key takeaway: there isn't one single cause, but multiple risk factors that stack up over time. Diagnosis and early detection. Now, how is uterine cancer diagnosed? If you go to the doctor with abnormal bleeding, they may recommend a pelvic exam, a transvaginal ultrasound, a biopsy of the endometrial lining, or in some cases, a D&C dilation and curettage. These tests help doctors determine if cancer cells are present and how far they've spread. Early diagnosis equals better treatment options and survival rates. Prevention tips. Let's talk prevention. What can you do? 1. Maintain a healthy weight. Even losing 5-10 of your body weight can make a difference. 2. Exercise regularly. Just 30 minutes a day of moderate activity helps regulate hormones. 3. Eat a balanced diet. Lots of fruits, veggies, fiber. Cut down on red meats and sugar. 4. Manage diabetes and high blood pressure. 5. Use birth control wisely. Some forms of birth control pills can actually reduce the risk of uterine cancer. 6. Consider the HPV vaccine. It's more known for preventing cervical cancer. Reducing HPV risk helps overall gynecological health. And of course, don't skip regular checkups. If something feels off, speak up. Closing remarks, let's wrap this up. Uterine cancer is real, it's serious, but it's also one of the most treatable cancers if caught early. So, know the symptoms, understand your risk, take care of your body, and never be afraid to speak to a doctor if this video helped you. Please give it a thumbs up and share it with someone you love. Drop your questions in the comments, I'd love to keep the conversation going. And don't forget to subscribe for more health content every week. Take care, stay strong, and stay informed.